Welcome back, everyone. As we've been saying all month long, June is Men's Health Awareness Month, and today we're talking about prostate cancer, which can be a tough conversation, but here to help tell his story of strength in hopes of helping others, two-time prostate cancer survivor Dennis Golden and his doctor, Dr. Andrew Salner with Hartford Healthcare. Gentlemen, thank you for coming by.
And thank you for having us.
An important topic. And Dennis, you've taken this journey, it's been twice now, right?
It's been twice. I had surgery back in 2015, and actually 2013, I'm sorry. And then just recently went through radiation therapy because the cancer was returning. And the idea of it is that what you try to do is to be sure that you can catch it the second time through. It can be cured if you catch it early. And one of the reasons that my first time through with prostate cancer, I really discovered men don't know a lot about it.
Yeah.
Men don't want to talk about it. Any issues below the belt line they don't want to talk about. So I formed something called the National Prostate Cancer Awareness Foundation. And the whole purpose there is just to have men be more aware, speak up, and especially what we try to do is get to the wives, the partners. That's really the most important thing.
That's a really good point. And you're using the experience as an opportunity to create the awareness. I know you're doing some things with social media, but Dr. Salner, how important is it, and how good is it that Dennis is doing this to get the word out? Because I always feel like it helps to see somebody's journey, their experience, what they're actually living through to really resonate, right?
It is important to get the word out, Scott.
Yeah.
That prostate cancer is the leading cause of cancer in men. There will be 165,000 cancer diagnoses, prostate cancer diagnoses this year in the U.S. and about 2,200 here in Connecticut. And we would like men to talk to their doctor about getting screened. Most men at average risk should talk to their doctor about getting screened starting at age 50. That's with a PSA blood test and a digital rectal exam. For men who are at higher risk because they're African American or of West Indian descent, they should start screening at age 45. Okay. For men who have a family history of prostate cancer, they should actually start screening, Scott, at age 40.
Right. We were talking about that, checking your family history. Right?
Absolutely. Many times, men will say, well, I don't have a history of prostate cancer in my family. But the same genes that form, if you will, breast cancer in women are the same genes that form the same thing in men. So if you have a mother or you have a sister who has breast cancer, there's a link there that really is important to explore. And a lot of guys just, I can't tell you the number of men I talk to who say, well, I'm not going to, I don't want to tell my doctor about it. I don't want to bring this up. And I think there's a lot of fear. So the whole idea is, and why we did the foundation, was just this whole awareness. Try to just get guys awareness. And as Dr. Salner said, 35 to 60, guys are, they're indestructible. They don't want to talk about it.
I think you're right, Dennis. There is a lot of fear of what might be found,
Right. And we know that if we catch prostate cancer early, we can cure it. If it needs to be treated, not all prostate cancer needs to be treated. Some can be watched with active surveillance. Prostate cancer represents a broad spectrum of disease. Yes. But if it needs treatment with either radical surgery or radiation therapy, both treatments have improved substantially over the last 10 years. There's much less side effects from treatment. People return to work and normalcy much more quickly. There are many fewer long-term effects of treatment.
Okay.
And so no reason to be afraid of getting screened. And if you have the diagnosis, you should know about it. Don't put your head in the sand. Know about it and make an informed decision about how you would like to handle it.
Okay, and before we go, I want to talk about this. It's a walk or a race coming up. Let's make sure we get the information out there about that.
Absolutely.
Sure. ZeroProstate.org. Zero Prostate is the national foundation that focuses on screening, and that race will be at Dunkin' Donuts Park next Saturday, June 30th at 10 a.m. You can run 5K or you can walk the race, and it's an opportunity to support this wonderful organization that sends all the money back to us to do screenings to the underserved populations of Connecticut and to support prostate cancer programs.
Gentlemen, thank you so much for coming in. Appreciate you taking some time. We'll put all that up on our website so folks can find it, okay? Gil, we're going to talk